Hello, Newburyport Public School families. This is Cathy Riccio, and I just wanted to share some information and talk with you about what your students and you should be expecting when we start school next week. So I've created a PowerPoint presentation for you to answer a lot of the questions that have been coming my way. And I want to tell you, we are really looking forward to seeing the students in the buildings again, and we look forward to hearing how things are going. Talk to you soon. Hello, Newburyport families. This is Cathy Riccio again, and I'm here to talk about your students returning to school. And I've called this presentation Staying Healthy, Staying Safe while Returning to School in 2020. And we also, as a community in the Newburyport Public Schools, are working to create a culture of health and kindness. And I'm going to talk more about this throughout this presentation. So as we know, we were pushed apart by the pandemic, but we're pulling together. And the way to see this being done is if you notice all these different pictures of all of you out in the community. You've put signs on your house, you've made posters for the teachers, and we were smiling and yelling back at you. And then there's different groups of kids. There's the group of high school students in one picture. Our food services folks putting together thousands and thousands of meals since March. This is the group of school nurses in the Newburyport Public Schools. And this is our excellent SRO officer. But all of us are part of making this work and being safe together. We're pulling together. I kind of want people to realize it's not just one thing, it's a handful of initiatives that makes us safe. So we're going to talk about it, and I allude to looking at your hand and realizing that there's all these different components. We're going to start off with the daily self-screen and eventually be looking at the community data. The pointer finger is definitely the mask. The middle finger is the importance of physical distance. The ring finger, we talk about hand sanitizing and hand washing. Pinky finger is talking about the disinfectant that we're doing in our building. And then back again to the thumb, all the different types of testing and ventilation protocols that we've put in place, or all the ventilation work that has been done to keep everyone safe. This is a symptom screener for students in grades pre-K to grade 8. This is a link that you'll be sent. We're asking that all parents fill out this screener for their students from grades preschool to grade 8. It's 2 simple questions. You'll just add your email address in, your student's name, and then you'll answer these 2 questions. Today or in the past 24 hours, have you or any household members have any of the symptoms below? And we're certainly, if you have a history of asthma or allergies, then certainly you understand the difference of something that's different. If you have a new cough that's different than what you normally had, or a new headache that's not explained by something, then we're asking everyone, please stay home, protect yourself and others, and get this checked out. Make sure it might not be a symptom of the coronavirus. And then the second question is, in the past 14 days, have you or anyone in your household had close contact with a person known to be infected with the novel coronavirus? Our high school students are going to have a different screen, because we believe our high school students, we're encouraging them to take control of their own health and knowing their bodies. Certainly parents, we're asking you to keep an eye on everyone, but the students are going to have their own screen. And the link, when you save it to your home screen of your cell phone, and all the links should be saved to the home screen, so you can just quickly click it every day. The students, when they answer their questions, their 2 questions, they will get a green check mark. So they should hold that check mark in place till they show it to the school administrator, who will be at the entrances, and then they hit the button submit. And that's why that blue arrow is down at the bottom there. They answer their questions and then hit the blue arrow. So again, just before coming to school, think about these 4 questions when you are going to complete your daily home screen. Do you have any of those symptoms greater than 100 degrees fever, shortness of breath, new loss of taste or smell? In the past 14 days, have you had any, have you been with close contacts or with people who have symptoms of COVID? Have you or anyone in your family been diagnosed recently with COVID? And then just to keep in mind, have you traveled outside of Massachusetts in the past 14 days? Only I'm just reminding folks of this. Just keep an eye on the travel before you leave, or keep an eye on what the state is asking us to do. So with all of this, please stay home if you're answering yes, any of those, or keep your child home if you're answering yes to either of those questions. So what to send with your student to school? Well, they need to wear a mask, especially on the bus. And we recommend you add a second spare mask in their backpack in a plastic bag to keep it clean. I would put your child's name on the mask if you can. We also recommend a brown paper bag in their backpack so that when they're eating lunch, that's a safe place that they can put their mask and it's not going to be lost or moving around all over the place. And then for the Bresnahan schools, please remember that snack and lunch needs to be peanut free. And actually, just be mindful of this, since students at the Bresnahan and Mullen will be eating in their classrooms, and the NOC will periodically be eating in their classrooms too. So I ask all families, please be mindful of what you're sending and be as safe as we can be. And I've included a link. This is a link that is shows the efficacy and how protective masks can be at keeping people safe and reducing the spread of the virus. And it also helps prevent the spread from asymptomatic people. And another good tip for masks is it helps remind you not to touch your face. So we recommend that students wear 2 cloth masks that are 2 layers, no neck gaiters or bandanas. And the links that I've included in different PowerPoints are links to research or information that reflects back to what I'm recommending. So again, the right way to wear a mask, a nose bridge is very, very nice. It keeps it tight around the nose and it reduces fogging of your glasses, and then keeping it tight around the chin. Again, for high school students, no neck gaiters or bandanas. This is not the right way to wear masks, so let's all try to do our very best. And just reviewing I think we all know how COVID is spread, but it's important to remember that all these different health and safety protocols that we're putting in place is to reduce the route of transmission so that we protect you from ever acquiring COVID while you're in school. So we're working very hard for that. So we've been doing different things that help us to disinfect in local areas, disinfect the surfaces. Everyone will have masks on. So another important part of this is maintaining physical distance. And we're asking the students to also respect that. And even though you haven't seen folks in a while, we're asking that everybody stay apart, but you can keep smiling under your mask, you can wave hello, but the desks are now 6 feet apart, and so everyone kind of stay put in their places and be mindful of that. And when you're coming to school, make sure your mask is on. You'll typically see 1 entrance and 1 exit. High school students, show your green check mark and then hit that button submit. Hand hygiene when you get into the building. Stay 6 feet apart. But the important aspect of that is also support others who stay 6 feet apart. Proceed to your classroom, and remember, by doing all these things, you're helping us create a culture of health and kindness. Adults touch their face about 15 to 20 times an hour, so students do too. So that's the beauty of hand washing and why we'll be doing a lot of hand washing in the schools. So encourage your kids to be supportive of that and to do a nice thorough job of getting the job done. There's these 6 steps that I've included for that little sign there. We also be using 60 to 70% ethyl alcohol-based hand sanitizer, and that's will frequently be offered in a small amount for students to kind of spread across their hands. Here are the steps to putting hand sanitizer on your hands. So again, to reiterate, ways to protect ourselves will be washing our hands often. Gloves will be used by staff for periodic short-term procedures only. We'll encourage everyone to keep hands away from your face, and actually there's some really nice signs that are up around the schools. Wear your mask properly, please. No neck gaiters. Practice social or physical distancing while in school. Please stay home if you're sick or you have questions. Don't hesitate to call your school nurse. We're going to be cleaning and disinfecting high-touch surfaces. I'll be talking about the disinfectant we're going to be using. And I've included a link down here. It's called Community Use of Face Shields as a Mitigation Strategy. I included it just so that you know some of the teachers might be wearing a face shield, and it's only because some districts are recommending it. We have offered it to our staff for anyone who might feel comfortable. You still see the teacher's face. They are still wearing a mask, but just so that folks know, that's where the research came for that. So what is the disinfectant we're using? So we are going to be using hypochlorous acid at 200 parts per million. And that is what the spray bottle looks like. And that's in the classrooms. And it's a very excellent disinfectant. It's one of the top 5 EPA recommended disinfectants for the coronavirus. It's a product that's actually made with salt, vinegar, and water, and then it's electrolyzed by pulling the electrons. It turns into a mild bleach, a mild acid, and it's what's really nice about it is that it eventually becomes less strong over time, and it becomes ecologically safe after around 14 days, so that while it's a very effective, strong bleach against coronavirus, it's ecologically a nice product for the schools to be using. So it's very safe for our students and staff. Hypochlorous acid, just to let you all know, at 200 parts per million, they use it for eyes for people with conjunctivitis. At 60 parts per million, they use it as a no-rinse sanitizer for food. At 100 parts per million, it's used as a wound cleaner. But then for us, we are going to be using hypochlorous acid at 200 parts per million and for our disinfectant. So just to review what we're going to have in the schools, we will have 60 to 70% ethanol. We do have, that's just alcohol, but that is in some of the nurse's office for some of our equipment and also in the hand sanitizers. We also have some products where we have 5% hydrogen peroxide, and we have hypochlorous acid as our main disinfectant at 200 parts per million, which then becomes less toxic over time. I don't know why I'm stumbling on that. And we also have purchased a fogger so that we can then be able to distribute the hypochlorous acid at less than 20 parts per the size of 20 microns. I included this quick slide. This is a kindergarten class going to school in China, and they spray hypochlorous acid on the hands and on students' bodies before they go to school. We're not doing that, but we're certainly using that really good disinfectant. So I just wanted to also share with you how we will be monitoring community spread in our area and what our exposure analysis will be. And we look at this all the time. We have medical advisors helping the school district. So we will be, certainly people are asking how would we transition from our hybrid in-person model to a remote model. And certainly if the state mandates it, if we have a 7-day positive COVID test rate in our area of 4%, New York City uses 5%, but we want to be cautious. We're also going to be looking at different trends, what's going on around us, because that can affect us, but we certainly will keep our eye on Newburyport. And the two major areas that we'll be analyzing and getting information from is from the Harvard Global Epidemics link and the Department of Public Health. So throughout the day, please remember every morning your daily home COVID screen. Answer those 2 questions. Frequent hand washing coming in and out of programming, but for students that just means when we're doing hand washing, just do it as thoroughly as you can and use a paper towel to turn off the faucets. If there are faucets, try to keep yourself as safe as possible. Wear your mask. Certainly very short mask breaks will be calculated and offered, because as you build tolerance to wearing a mask, you kind of need a quick little couple breaths, and that you just unhook your mask from behind your ear, take a couple breaths, and then put it right back. It's seconds. But for outside is when the main mask breaks will be happening. Pack a spare mask in the backpack in a plastic bag and put the student's name on it. Know that we will be taking movement and outdoor breaks. Also pack a brown paper bag to store the students' masks they're wearing that day when they're eating lunch. We use the hypochlorous acid that we use is Force of Nature, and there's a bottle of it being electrolyzed right there. And so that there are different, in 1 minute it sanitizes the surface, in 10 it disinfects. So we will be utilizing the surfaces and in between classes and that type of thing, the disinfecting. Help us to be the best we can be by wearing your mask and staying 6 feet apart and encouraging others to do the same. We will be opening windows when appropriate, and remember to be kind to yourself and others. And lastly, we're gonna get through this when we're pulled together, when we build our culture of health and kindness for others. So they're asking, I wonder what teachers make? And the reply is a difference, Peppermint Patty. They make a difference. And the teachers that I've had the privilege to work with in Newburyport are some of the most dedicated and inventive and amazing folks I've had the privilege to work with, along with the nursing team and actually all the folks in our district. So we look forward to seeing your students, and take care.